So welcome back to the Evolving Warfighter. I'm Dr. Franklin Annis, and today I'm really excited to have a conversation that's near and dear to my heart, which is training combat medics and how do we improve the preparation of really the frontline medical providers before they go into combat, and then how do we keep up their skills when they come back home and go through multiple years of service. So today I'm very honored to be with a veteran, Lauren Swensson. She is a veteran with 15 years of service. She's deployed multiple times to Iraq, 3 times to Iraq. Looks like you've served in 3 different components. So you went from the U.S. Marine Corps to the Army Guard to the Air Guard. So lots of different experiences in terms of where you've been inside the military. But most importantly, she went out there, became a combat medic in the Army, and then looking for better training, you helped shape and design a program called the Advanced Medical Sustainment Trauma Training Course. And today we're really to jump in and have a conversation about what you've done and what you hope to do. So thank you for being with me today.
Thank you so much. No, this is great. I'm so happy that we were able to get together and have this conversation.
So I read just kind of a little bit of your story in terms of an article floating around about your training, about how you were a Lance Corporal in Iraq and you went to volunteer, essentially help in trauma, the Receive and Trauma Center, and then this kind of sparked your interest. Could you tell us a little bit about that experience and how it shaped your life?
Yeah. Yes, absolutely. So that would have been 2006, and I had just finished just about a month prior the NREMT course through the Navy in Okinawa. And so I was super excited to have that new NREMT licensure. And I actually wanted to do something with that. I got deployed to Iraq, found myself in Iraq about a month after getting done with that course, and went to the BAS and to sick halls and all those like hard structure medical centers just to see if anyone needed any extra help, and kind of got turned away from all of them. They were full, and then I found my way kind of down to the end of our camp. I was at Camp TQ at the time, the Al-Anbar province, and they had the SSTP, the Surgical Shock and Trauma Platoon, and kind of wandered in there and said, hey, I'm a Lance Corporal in the Marines, and you all are all, high-speed corpsmen, and I want to help. And they kind of looked at me funny, and before we could even really get introductions underway, we got a 15-man mass casualty from mortar attack in, and I helped with that. And after we kind of got everybody packaged and shipped out and did what we could for everybody else, I went back to I was with a comm company with the Marines, went back there, and then the next day went back to the SSTP, and they were all kind of shocked to see me, and they like, oh, you came back after that? Wow. And that's just kind of where it started. So 3 deployments, all back to TQ. So every time I was there, I volunteered at the hospital, and got over 1,000 hours of volunteer time, like just in between whatever we were doing on our side. As a radio operator, I would be over there helping out, and that's kind of where it started.
So I'm assuming, and this might be where we break into the conversation, so your 68 whiskey training that you received through the Navy, did you have any chance to actually see live patients before you finished that course at all?
Well, so for NREMT, my EMT certification that I got through the Navy, I did do a couple rotations with the Japanese firefighters. That's who they used in Okinawa, and which I could like barely fit on their ambulance, and a couple nights in the ED, and that was more civilian patients, non-trauma, more medical, for both kind of the house calls and in the ED. And when I got out of the Marine Corps, I ended up going into the Army Guard and doing that 68 whiskey training. And for 68 whiskey, I did the prior service,
Okay.
which is at Fort Bragg. So it's
Okay.
3-month course, accelerated course versus the 6-month. Had to recertify on my NREMT because I lost that while I was deployed because I was a Marine, so they weren't really responsible for my recert. So retook that, finished 68 whiskey, and we did 1 weekend of intake in the ED, which we did have some trauma because they did have a group, that were jumping that weekend, and something went wrong, and they all actually, left the airplane incorrectly and landed very badly. So good little.
Yeah, so this kind of ties into my own experience. So I enlisted into the Army Guard myself, 2008, as a combat medic. I had experience as a paramedic before enlisting, but my certificates had expired. So I went through the full training down at San Antonio. And I believe in that training, we spent a total of 2 days inside Brooks Army Medical Center, or BAMC, and I think it's called SAMC now, the hospital down there. But there's so many trainees down there, and there's so limited patients that you really get to see more kind of sick call type patients.
Yes. Yes, it was just on a whim that they had some trauma, and that trauma went straight to the OR. They were really assessed in the field and just sent over, for surgery. So kind of just used the ED as a waiting, as a hold to get them up. So we didn't really even evaluate, but that was not normal. You're right. It was just more sick hall, more medical emergency.
Yeah. So when I deployed, I was a platoon leader when I deployed to Iraq in 2009, and I took 26 soldiers in my platoon. So less than half of them had any type of real life emergency medical experience outside of kind of that limited Army scope. So it's kind of that problem where here we need to build a large number of medics for the Army, but getting them that experience before they're unsupervised. And at least for me, I had to sort people and say, hey, you need to go on this convoy, and I sure hope you don't lock up the first time you actually see a trauma or attack. So I'm quite sure that with your experience walking back into 68 whiskey training, you probably carried a lot of different attitude towards you when training versus some of your other peers. Would you agree?
Yes, absolutely. And I didn't really understand that at the time. It took me a minute to figure out what was going on, and then I realized it was because I had that experience. We had about 20 people in the course, and there were probably 6 of us that had prior service medical experience, the others being prior service something else.
Okay. And
we all figured out really quickly who we were, and at the time that we were prior service, that was kind of that height of that OIF, OEF. And I saw the same thing actually in Iraq. When I was working with the Navy at those SSTPs, there were, in the beginning of, the time together with them and them being new, like in country, there were absolutely, casualties that came in, and things were not as fast as they were. Things were, it was, confused, discombobulated, who's got the blood warmer, where is the blood warmer, who's getting labs, who called walking blood bank, those things. And, it only took, that to happen, once or twice before it was every day, all day. When you didn't have patients, you were practicing what you were going to do with patients. I mean, that happened real fast. But a lot of the corpsmen that I spoke with that were, even the OR techs, the surge techs and things like that, they said, well, we're just supply back home because we don't have an OR. So I work in a supply room. I haven't touched an instrument since, AIT. That was the reality of the situation. So I did pick up on that for sure. And I saw it again at 68 Whiskey School. And I took it really seriously, and I did explain to everyone why. And I wasn't the only one. Like I said, we had a corpsman there that was with a grunt unit. He was deployed 3 times, and then a few other medical personnel. So, they all absolutely took it really seriously, and, got asked to be an instructor at the end. So, it was good training, but I did, just like you said, it was all mannequins. It's not real. I was a surge tech. I got my surgical tech when I first got out of the Marine Corps, so I was very used to, working with, that anatomy, and you don't see that anatomy unless it's on live patients. So.
Well, yeah, and there's a whole theory called simulation fidelity. So the more realistic that you can make a training to what you would actually experience, the more practical knowledge that you can gain from that experience. So
absolutely.
If you're using unrealistic mannequins in your training, even though you're doing a lot of training time, you may not be gaining a lot of valuable skills out of it. And there is some debate that, when we're very first learning skills, you don't really need a high-level mannequin, because the first time you're putting in an airway, you just need to focus on finding the right space. So that can be a mannequin, not realistic. But the more advanced we get, the more realism you need to get. And then at some point, I would argue that we stop training medics and we just let them go out and work and experience some civilian trauma. And that way it's just kind of them not necessarily learning the medical skills, but just learning the skills of whether it's scene management or you're just dealing with the randomness or the craziness of what you might run into in emergency situations. But
oh, absolutely. And you don't want to put anyone in that high stress environment when you're trying to teach them. You don't need the wrong kind of part of the brain taking over. But you absolutely do need that, crawl, walk, run, I guess you could say, scenario. And we kind of get stuck in this crawl, walk phase, and we never make it to the run until it's for the real deal. And that's, you've been there, I've been there. There's lots of people that have been there, and that's not when you want it to count for the first time. We can all say that. And there are absolutely, surgeons don't do a residency if it wasn't necessary. You're never going to go to a surgeon that's never performed a surgery before. You're never going to sign up and say, I'm going to go have my gallbladder removed, and the surgeon is going to say, oh, well, I did this on a mannequin yesterday and I just watched YouTube videos, so we should be just fine. That would never happen, right?
Well, yeah. Would you like a trained doctor or experienced doctor? Everyone wants an experienced doctor.
Right, absolutely. But there is a way, and again, something you and I both agree on. There is a way to do in a controlled environment for teaching, for training, and for doing, and that can be done, and it's done in all forms of medicine, and it should be, and it can be done in military medicine. So.
After 68 Whiskey School, to my knowledge, you had a chance to go through the Rush program. Could you talk a little bit about that and then what that might have inspired?
Yes. So, that was the first time I was very fortunate to be able to attend the Rush University trauma training program in Chicago. And that was in April of 2014. Actually, NPR did an article on it. A few months later, it was the highest GSW gunshot volume in a weekend that they had seen ever before. And it also is attributed to, it was the first nice weekend of the season. So we were kind of, we were in luck, I guess you could say, for trauma training. So that course was just amazing. There were only a handful that were able to go from my state at the time. It's just a very expensive course, and so they had us, only a certain amount were allotted to go. And Rush University is a teaching hospital, so it's not a trauma center, but they do teach. And then we were able to go out into Cook County and go to the EDs there, and then do the ride-alongs with the fire department and EMS. And it was that hands-on training that I really enjoyed. that I really think is necessary. And, I'd had experience, with patients before. So for me, it was nothing but excellent training. For some other people, and we had medics there, we had physicians, and we had PAs that were that attended the course that we were at from kind of all over. Some had experience, some did not, and with live patients, and some actually figured out that within that 2 weeks that they didn't want to be medics, that they were not okay with it. And the perfect time to figure that out is in training. But it was just that controlled situation, out with the medics, out in the field. We could, do whatever they would allow us to do, what we were allowed to do within our scope. And then in the ED trauma, we actually had like the on-call trauma doc would be in there with us, and, we would do what we could, to our scope and what was allowed. But, with those MOUs and everything else, it was wonderful. It was great. And I kind of realized, and I was new to the Guard at the time, and, kind of new to all that stuff in my career and medical itself, being, in the military, just how expensive that stuff is, how rare this training is, how special of an opportunity it was to go be a part of that. And then also just realizing that it's very necessary. It's all those things. It's very expensive and very few and far between, but also very necessary. And that's kind of when I spoke with one of the doctors that I worked with in the OR, that's also a veteran, wonderful, amazing surgeon, about this course that I went to. And he would actually come and teach some of my medics sometimes, just on the weekends, in his own time, and just, teach a crike or, teach splits, just things like that. And he loved it, absolutely enjoyed doing that. About, hey, this program is going on here, and, we have most of this stuff at KU, and, he was like, we have all of this at KU. I mean, we have everything. And, I think you should talk to so-and-so, and let's get you hooked up with one of our nurse educators who's also a veteran. And so that was probably by in 2014, kind of like a few months later, I kind of had my first class that was, hey guys, you want to get a free ACLS and PALS certification, and we're going to have a cadaver there too. You'll have to come on your own time. It's, during the week. But if you want to come, KU will, provide the certs. And I think I had about six medics show up, another med student, and that's kind of where it started. So that was 2014. Since then, we've kind of grown into a modular program where we've included didactics. I took everything from the Army curriculum, plus, everything, joint trauma training, and then my other counterpart, she took everything from the air side, kind of combined it. Air is kind of more clinical based, Army is more trauma based, both very important for exposure for, either or. And we actually involved mostly veterans, not all, but mostly veterans from KU. They volunteer their time, that are faculty. It's a teaching hospital. It's a level 1 trauma center. So we have like the specialists of the specialties. Our head of anesthesia is a Navy veteran. One of our other anesthesiologists used to be a 68 whiskey. I've got an ENT surgeon. She was a Marine. Then we have our head burn ICU nurse that comes and teaches. Head of pediatrics comes. We've got my doc, who's in the Guard. He comes and he teaches. We've got all our trauma docs that come and teach kind of Cadaver Lab. And we just take all those skill sets that are required from that level and just teach at a higher level. so that they really get something out of it. That was my main thing, not to be taught, I can stand there and teach, TC 800, right? I can read a slide, and that's a check off. And then I've done my tables, and I can do that. I could do that as a 68 whiskey, as an E5 68 whiskey, and teach. But you're doing the same thing every year, and you're not learning anything new. So I really wanted to make it something where, one, the education was taught at a higher level, and that, two, they would get something out of it. So also offering the ACLS, the PALS, the BLS recertification, pre-hospital lifesaver, the PHTLS, and ATLS for providers meant that they left with certifications. So not only were they having a good time and getting the didactics and doing a sim, we do a sim, and then we also do cadaver, but they were leaving with certifications, hours they could use towards recert. And this is all at no charge. So I had all these people are donating their time, and then KU is actually paying for these certifications and the rooms. And then we worked on getting an MOU. And so we've added clinicals and ride-along times as well. So that's like ED, burn, neuro ICU, med surge, so they can go and get some hands-on. Really, that's the foreign side of it for the Air Force. They really need a lot of that clinical time for their CMRPs for recertification, but as well, it's very important for the Army, medics and nurses and personnel to get that hands-on that they really do need, also.
When you say it's modular, so you listed off a tremendous number of very valuable certifications there. Has there been kind of a trend where, like, hey, an Army unit comes in and this is kind of the 80-hour block of instruction, or is there a certain length that you're used to or accustomed to?
Yeah, so so we can do it like 1 week block, 2 week block, kind of depending on their AT schedule, if they're like pre-deploying and what they want and what they need. And I can do it for at an individual and just have like a mix of we have active duty Army, we have Navy that come, we teach SWAT, we teach paramedic students, and as well as the Guard, Air and Army side, and from whatever state. Sometimes they just, like I have a flight unit, and their medics really just needed to get recertified. So we said, okay, well, you don't need clinicals, but you need ACLS and PALS. And so we'll do that. And then, we'll get some didactics and do a Cadaver Lab while we're here. So theirs was like a 5-day. I have others that are doing it like pre-mob or they want to use it as an AT. So then we'll do 2 weeks. And, we'll do, the schoolhouse, cadaver. I like to keep 4 people on one body so that everyone kind of has, is able to see. So, we might have to do, half the class, in the morning and half the class in the afternoon, or half the class one day and half the class the next day, just to kind of make sure everyone gets that done, depending on how, the size. And then for ACLS and PALS, I've had just where providers of that unit, they weren't able to come in for the didactics, but they need to get recerted. So they'll join us for that. So we like to be, at this point in this stage, we can be flexible. I have a set agenda, set schedule, but, I also want to make sure that I, do what the unit needs. I can do what they want. To make it, for best for them, because I know time is of the essence, and orders and ATs and all those important things, fiscal years. So
just to reiterate, to make sure I'm hearing you correctly. So if, hey, I'm a infantry company and I just want to send 1 or 2 medics down to your program, that's something that you could support. Or say I have a ground ambulance platoon, you could fit either the small individually ones or twosies or like larger organizations. Is there kind of, what's the biggest class sizes that you get into?
I think our biggest was 20. And really I have a set schedule of like, this is what we offer for this fiscal year. These are the weeks we're doing it. And I really need everything kind of 3 months in advance as to if you want to go. And so I've had like, same like repeat units that, keep in touch and say, we're going to send this many, or, they'll call and say, we've got 2 that really want to go. Can you squeeze us in? And it's really just, instructor base, and the cadavers is really what kind of keeps that in line. So the cadavers, KU is a drop site. So that's good. But they are $2,800.
Okay.
So, that's just that, which they will cover, but, I got to make sure we order those, in time. But, and instructors that are volunteering their time. So I just, need to, I may try to make sure that all that's taken care of. But I've done for groups as small as 6, and then we've had 20. So we can do it all.
Your Cadaver Lab is really interesting to me because that's something that I never had a chance to in my medical side of the house to experience. But like I could imagine you do chest tubes. You do venous cut downs.
You could come here to the AMSAT course and you could see for yourself. You absolutely could. So it's kind of amazing. It used to be this room with no windows that looked like something out of like a Disney haunted house lab. But they just built a new one, which takes up like half of the hospital floor. There are flat screens at every body, so everyone can see everything that's going on, smart boards everywhere. So head of sometimes cardiac will come. I'll have, and I'll have a trauma in there as well. ENT. So we'll do crikes, we'll do intubations, we'll do chest tubes, we'll do cardiocentesis. We'll crack the chest so everyone can kind of see what's going on and how, all of that works. And then we'll do some cut downs so they can practice suturing. We do some chest seals and and IOs. That's kind of what we like to do with that, and whatever else the docs want to teach that day. So it's a great experience.
Yeah, I can imagine. That's a heck of a lot of training you listed there. The best thing I got was the the instructors brought in cow hearts to dissect in my paramedic training. That was my only.
Oh yeah.
Yeah. But.
Which is fun.
Oh yeah.
That's really fun too. Yep. We've got a shop. One of our ENT surgeons, she will bring like the pig heads in.
Okay.
She's offered to bring the pig heads in and with the laryngoscope to kind of teach intubation and the anatomy as well. So that's kind of like a little smaller piece, but also just, it's amazing. It's just so neat because all the people volunteer their time. Nobody's forced to be there. A lot of them are veterans, and they all just, they get so excited, because the medics get so excited about it.
Well,
so
if you do good training, it's fun to be there.
Yeah.
If you do bad training, you don't want to be there.
Right. Very true. Very true.
So you've run this for obviously a number of years. What's the type of feedback you're getting, either individually or for units? What's kind of the back end? Like, what are you seeing in terms of your performance?
Well, so we do kind of like a monkey survey, and then I also ask, so most of the time we end a lot of sessions with the ACLS and PALS. So after everybody's finishing up their test, I always ask if anyone wants to write a comment. And I always, take all the comments and I'll retype them and I send them up to our, through the chain. But we do a monkey survey as well. And it's, because this is all volunteer for me. This is all just kind of like an extra time that I have to do this program and to create it. Like I don't work for KU. This is all just extra, and I have not, I've had, and I've had people say it, not just to me, but in front of people to me that, not from my unit, from other units and even different services, that this is the best training that they've ever received their whole time in the military. And not just once. And we've had, all ranks all there, all different backgrounds, and then just, higher ups just to come observe. And besides one of them passing out in the Cadaver Lab one time, it's all been smooth sailing and everyone's really enjoyed it. So it's so neat because I just, as soon as I went, realized, we need this training, and saw a way to do it, I just did it because it's needed. And it's just so necessary. And I was really surprised that it's not found easily. I do understand it is difficult to do. I mean, it's a lot of work. It's a lot of work. It does take a lot of time and a lot of effort to make things like this happen. And you got to keep that energy going.
Yeah.
There is that part of it. So I guess that's not the easiest thing to do in the world, but it's just very necessary. And I will keep doing it for as long as I can, because of that.
Yeah, I think the advertisement part is the hardest part in the military, because if it's a really good training program, you don't tell anyone. That way your unit always gets in.
Well, I'm trying. I really am. I've reached out to AMED a lot, many times, and I'm really, really trying to get this crosswalked. COVID was kind of a setback. That was tough for everyone. We couldn't have students on the campus, that time, and then just trying to get everything restarted, which this is kind of, this is when that's happening right now. Everything's just kind of coming back to life, and kind of doing that pulse check, see where everybody's at. So reestablishing those relationships with AMED. If anyone out there knows anyone at AMED that can help me, you've got my contact information. You can put it on, you can put it out there. But
So this is, I guess, a good enough time as any. So is there contact information if we have commanders or medics interested in your program? What's the best way to contact you?
Absolutely. Well, it's my personal email, which I will, which that's just kind of how what I'm using. We do have a liaison at KU. We have that helps me. That's an educational person at KU that is, like the one that gets everything, going in reserves rooms and things like that. So we've got that piece. But first is just to contact me, and my email is 68WLSWEN0621@gmail.com. I almost even want to give my cell phone number out, but I will take, I need help. That's kind of where we're at. I've also reached out to NGB, to either become a partner. KU is very interested in becoming, that they want to do more. They want to help. So I've reached out to contacts with the SMART program, and through their training, with G357, just to see if there's anyone that's interested in wanting to help with this, just to get the word out. Big dream, big pipe dream is to get these didactics and Cadaver Lab, have these hours as CEs in the 6-8 whiskey mods, because that's what really counts. They can get the ACLS and the PALS, but if we could get it in there, it would be visible, to all Army, and that's important. Getting that visibility out there. Second half of that would just to have a course number in ATARS. That's advertising in itself, and that's it's out there. It's free training. Well, it's not free, but someone else is paying the bill.
We should caveat that and say, commanders, it's free in terms of you don't have to pay to attend. You still have to worry about
Well, you
orders
gotta
and
put them on
lodging.
orders, and they got to do a DTS. But besides that, it's covered for now. For now, who knows what's going to happen with that. But so I would like it to be official, just like the Rush course is in 68 Whiskey Mods. I don't know why my AMSAT course can't be. It's been around for almost as long. And then, to do a partnership with NGB so that we can get, some training, get more people here. There's nowhere, there's not really a Midwest, point right now. So it would be nice with a burn unit, with all of that. That's a level 1 teaching hospital. There's level 3 teaching hospitals, but there's no level 1 trauma center teaching hospitals with a burn unit besides KU in that area. So
I was going to say credentialing, at least the bureaucracy around credentialing in general, I think is often a stumbling block for the Army, because obviously anyone with common sense could say, hey, this is remarkable training. Like, I could take my medics out behind the armory and walk through the same Table 8 book to run through the exact same drills that they've done 16 times in their career, or I can, get them in to see a cadaver. It's just that difficulty of navigating systems and getting relationships built to put those in and codify them. So, it's seamless.
Well, and it's very simple. I've done the process for CLS course. We have to build our own numbers to build a course in ATARS. It's so funny. It's just the bureaucracy of it, because the actual physical process is very simple. And the didactics are there, and everything, the hours are there, the training's there, the professors are there. But it just for some reason we just can't make it happen, and which is unfortunate. I'm very grateful that in my previous experience, command has been very, very supportive of it here in the state of Kansas. And, I wouldn't be able to do, any of that or continue it without that. And all the support from everyone at KU. Like, it, would not be possible, physically would not be possible if they would not allow us to come and receive that training. So I'm, very, very thankful for that. Just need it one step further so they can get credit for it, so that it does become, normal, and standard. It should just be a standard and be available for that.
So outside the credentialing piece and getting this worked into the Army systems, do you have any kind of short-term improvements you're hoping to make on the course? Any long-term kind of really big dreams of what you'd like to see this turn into?
I do think I would like to see, if it's going to grow somewhere to become, that part of like a schoolhouse, like a permanent fixed structure. Would be wonderful. Right now, when we have a class, I go to there's like 4 or 5 closets on campus that have my equipment, and I've got to go to all those closets. And then, the 10-mile radius that is KU, I've got to wander around the different buildings to get things set up in whatever classroom we could have, received for that training for that day, which won't be the same as the next day. And so, I get my steps in every day. So, there's that. But I would absolutely love to have some sort of permanent schoolhouse for the program so that it could become, it would exist. It would exist. It would be a physical structure. And, on that, for the recognition on the campus side, the KU side, and then as well on the Army side, or military side, NGB side, that would be pretty amazing. And then just for it to continue, that's really all I can ask.
Yeah. So I guess I have a question. So logistically, if I was a commander and I was thinking about sending a whole bunch of folks down there, is there other outside of like hotels, obviously in the area, is there any military facilities like a regional training institute or a base nearby that can handle housing at a cheaper, more affordable cost?
So what we do, there is a hotel on the campus. There's like a Holiday Inn IHG, and they will accept per diem rate. And so I wrote an op order. Well, not just me. I had a very smart officer help me write an op order. So yes, let's be honest. Help me do that. And then every year I update that, but in that is, location and lodging. And so we just use that for lodging, which we've never had an issue. That's always been allowed, getting the government to fund that, because if they were going to use AT dollars, they would need that lodging. And then when you look at the cost comparison for training being, at no cost, and then just having to do lodging, and M&IE per diem, it's a deal. So I really haven't had any pushback with that yet. But there is an armory. There's a Kansas Army National Guard armory that is close by that I have brought up before. Just like if we were to bring so many, or they were doing maybe some field training as well, or they were already doing AT at that location, then they would just come from that location. We could just like bus them over or something, and then it would be, at no cost. So, where there's a will, there's a way, but I haven't had too much pushback with that. We worked out with the hotel on campus, hey, we need the government rate. It doesn't show up that way on DTS. I just want to let everyone know that. It shows up a lot more expensive, but if you go in, show them your ID and tell them you're here for ANSAT, you will be charged per diem.
Oh, excellent. So did we miss anything? Any other topics you want to bring up?
I don't think so. I think that's everything. Like I said, if anyone has any questions, they can always contact me. More than happy to help. We do site visits. We've had commands come up just to do a site visit and just kind of, we put on a little presentation and just go over everything, all that, logistics and all, whatnot, just kind of what we offer. So we can always, have a group come up and spend the day and take the tour.
Okay.
And you are also invited to the Cadaver Lab,
I'll keep that
or
in
any
mind.
other that you would like to serve. So I will make sure to get you a schedule.
Thank you. Well, for the audience out there, I thank you for watching. I invite you to subscribe to the Evolving Warfighter for more videos on military self-development and military history. Until next time, focus on your self-development so we can dominate the modern battlefield. Thank you. Thank you, ma'am.
Thanks, sir. That was wonderful.